Dr. Miedema, Professor and Director of Research, Dalhousie University, Family Medicine Teaching Unit, Fredericton, Adjunct Professor, Sociology Department, University of New Brunswick in Fredericton.
Well, we are engaged in a number of projects. One is called the Quality COPS, or the Quality and Cost of Primary Health Care. That is a national study, and I'm the lead here in New Brunswick. And we have surveyed family physicians and their patients about all kinds of aspects of primary care and the value of primary care. So this is an international study. It started actually originally in Holland, and many European countries have taken part in it, as well as Australia and New Zealand. And so that allows us to do a lot of comparison between all those countries, because those countries have similar primary healthcare systems, but there are also a lot of differences. And Canada has a very strong primary healthcare system, but of course there are also some weaknesses in the sense that, for example, we have a shortage of family physicians. And if you have, quote unquote, a gatekeeper system, meaning that you have to go to a family doctor to be referred to a specialist, you have to have enough family physicians to do that. So this project, Quality COPS, will then allow us to compare wait times and how patients feel about their primary healthcare provider, and allows us to compare between all those countries. So we are just in the stages of analyzing that data across the country. We are very pleased that we were awarded a grant by CIHR, Canadian Institute for Health Research, for the SPORE network. The SPORE stands for Strategic Patient-Oriented Research. So a number of us in the province of New Brunswick, we worked to get this grant, and the New Brunswick Health Research Foundation is a co-funder of this grant. So CIHR now requires in many projects one-on-one matching funding. So the New Brunswick Health Research Foundation has provided that matching funding. So the intent of this project is that we create a network with all the stakeholders in primary health care in New Brunswick, sit around the table and come up with projects to see if we can assess some of ongoing primary health care models, if we have to look at new models, and how we can improve primary health care, particularly for patients with complex needs. In New Brunswick, we have a lot of elderly. We have a lot of elderly people with complex needs. And so I think it's very important to do this research in the province. I think the beauty of the SPORE initiative is that we can sit around the table with all the stakeholders, because we have gotten research money to do that, thanks to New Brunswick Health Research Foundation.